seen by you. In the process of selling your home, who would view your house this way? Well, obviously your lender. Who would view your house this way? All the same house now, of course. Well, this would be your buyer. Your house would be viewed this way by your appraiser. And finally, who would view your house this way? Your tax assessor. Okay? So everybody has a different perspective, and we need to be cognizant of that when we do training. I'm sure you're all familiar with the data that's been reported in NCRP report number 160. This is the data that's usually talked about, and the fact that the per capita dose that's given to the populace because of diagnostic procedures has grown dramatically in the last 20 years, but in some respects I think this is the more important point. The majority of the exams that we do on any given day are plain radiography, and the more complex exams are the minority, but if we look at the effective dose contribution from the minority of the exams, they're the biggest contributors to the overall patient dose. And as a result of that, if you look at this, 17% of all the exams done in a hospital on a given day deliver 81% of the total effective dose. And obviously the opposite is true. That means that 83% of the exams are only going to deliver about 20% of the dose. So where should we as medical physicists be concentrating our time? Well, of course, on the minority of exams that deliver the most dose. And then there was a paper that was published that suggested that 91% of